they're going to get angry at the nurse because yes, you really want to be taken. Nobody no one dead. Nobody wants to die. Me no one dead, you no one dead. And me no want you dead for my shift. So me gonna try preserve your life. Your life is more important right now than everybody else around. You have to find ways and means of trying to get a patient stabilized at the same time, and you have to think about the media. And you're not talking about the actual cameraman outside, but you have to think about, you know, how it look. Because I remember there are days when we had patients that were involved in a motor vehicle accident, or patients that were actually involved in a gunshot shootout. And those patients, they come in, we move patients from beds because there was no other option. And patients get upset, family members get upset because we have to try and resuscitate those patients. And when we are resuscitating those patients, nobody is thinking about the fact that the nurses have to kneel down on the floor to pump a life back into a person that had none. You understand? Nobody has the time to think about, oh, the nurses have to be doing this because there is not much staff available to help out. Alright? So when you come to America and you start working and we see the good up things that are going up here because there is so much resources available, it is nice. It is nice, and people have a different perspective, and nothing is wrong with them having their own perspective on certain things. But at the same time, we just need to be understandable that yes, while we can do better, it's not our fault why the system is like that. The system is already broken. The system is already broken to the point where we're not able to take care of the patients in a manner in which we want to take care of them. But when you come to America, because you have everything at your fingertip, you have everything you can dash away. You understand? You have everything you can throw away and not be worried that another patient is going to be complaining about anything. You can give the care that you really want. But when you have one bedpan circulate, the nurse have to go and take the one bedpan and wash it and bring it back to another patient. And plus, at the same time, you have to be dealing with all of the traumas that are coming in. You have to deal with the gunshot wound. You have to deal with the stab wound. You have to deal with the motor vehicle accident. How is it that the 4 or 5 nurses in the department are going to deal with a corn pan or two? Them can't deal with a corn pan or two. They can hardly deal with the emergency situations at hand. Much less to be dealing with somebody who has arthritis pain for years. Somebody who have a callus on them too. Somebody who go in, them a chop up onion and chop off them finger. Well, yeah, we're going to prioritize that. But then when you talk about a finger versus a person who has a tension pneumothorax, or a person who have a knife in them chest, what are you going to do? How are you going to balance it? You have to rush to the one that is going to cause death first. You have to try and stabilize that person first. And so a lot of times people get upset at the nurses, they get upset at the medical staff at that. So not necessarily only the nurses, but the nurses always get it. Because the nurses are the ones who have to do the medication. The nurses are the ones that have to do the dressings. The nurses are the ones that have to do the catheterization. The nurses are the ones who have to do the transport whenever we don't have 1 or 2 transporter on site available. You understand? The nurses are the ones that have to still go onto the ambulance whenever the patient needs to go and get a CT scan or MRI done. Leave the 3 other nurses over there. So, and the nurse are the same one who cannot even get a chance to go and get a break because there's so much things going on. And not to mention, the nurses are the same one who have to be sitting down in the ambulance and pumping that ambu bag to resuscitate a patient so they can get oxygen going in their lungs. So tell me, how is it that when we get into America, how is it that we are going to be treating patients the same way as how we would have been treating them in Jamaica when we have all of these resources at hand? Yes, the nurses are a little bit disrespectful, but when you're working real hard and people really can't understand what you're dealing with on a daily basis, they can't understand that, you know, you're doing your best to take care of the patient. Over time, persons are gonna get bitter, and the only time they're going to get sweet is when they move to greener pastures, when they move to a situation where they're getting paid, they're being recognized properly for the work that they're doing. You understand? We're not saying that nurses are not being recognized properly in Jamaica, but come on, when they talk about up here, you get nurses week and you get this and that. Even if it's a case where you get pizza and the pizza probably still, by the time you should get onto your night shift, then put some little thought in it. You understand? Yes, sometimes we do get it in Jamaica with not pizza. We do get our little nurses day gift and whatever in Jamaica. But at the same time, there's so many other things that are being offered to nurses here that makes them a little bit more happy to go to work, because you don't have to be doing all of the things that you were doing back in Jamaica. So persons need to understand, say yes, in as much as the situation or the care, it don't change, because the management of hypertension are the same, the management of stroke are the same, the management of heart attack are the same, gunshot wound, stab wound, it's the same management. But when you don't have the resources at hand, it can make your life be miserable. It can make the care that you're giving to your patient unacceptable. It can be a case where the patients are just gonna be in a situation where family members are just gonna be pissed all the time when they come to the emergency room. They're gonna be upset all the time when they get to the emergency room, because they are of the mindset that nobody is listening, nobody cares. But they're not understanding that there's so many thinking that the nurses have to be putting into place. They have to be thinking about everything that they're doing. You're not going to find a nurse just casually be walking around in Jamaica who especially work in the emergency room. No, you're not going to find that kind of nurse down there, because every step of the way they're thinking is a patient coming into the emergency room. As soon as they hear an ambulance siren go off, they're thinking, is a patient coming to the emergency room, and where that patient going to go? If a patient starts seizing, they're asking the same question, where that patient going to go? Because you're already at your maximum. You're already at your maximum. Sometimes you can't even find the medication to give. You can't transport the patient to get a CT scan because there's no money available. Family members don't have the money available to get the testing done. You don't have the centers available on site to do whatever testing you need for your patient. And so it makes everybody miserable, because a stroke patient is going to be there, and because of lack of money, lack of resources, they can't get their testing done. And so the patient relative looking at you, you looking at the relative, you looking at the patient, and there's nothing much you can do except manage or do palliative care in the meantime, because it's just really a reality of the situation. So I just find it, that sometimes, yes, we get the stare down every single day and we compare and we say whatever, but I appreciate the work that I did in Jamaica as a nurse, because a lot of time we work hard. The nurses down there, they work real hard. And so for people to come now and say that the nurses don't care, is only when they come to America they care, it bun me. It really bun me, but because they don't really understand, say, it's not a matter of when they come to America they care. No, it's just the environment that is different. The environment is different. Everything here is just different, to the point where you can sit down and have a conversation with your patient. You understand? You can imagine the amount of time that you're trying to take care of a patient in Jamaica, and the amount of time somebody tell you about your mother, and you still have to go ahead and take care of them. They're going to get angry at the nurse because, yes, you really want to be taken. Nobody no one dead. Nobody wants to die. Me no want dead, you no want dead. And me no want you dead on my shift. So me gonna try preserve your life. Your life is more important right now than everybody else around. So when it come on to deciding on who is to be seen first, the nurses and the doctors are going to decide based on their years of experience, their knowledge, their critical thinking skills. America deal with first come first serve because guess what? Them have the money that they can pay nurses extra money to come in because they don't want them hospital to get a bad name. Because this is all about a business. This is a business for them. They don't want the hospital to get a bad name. They don't want to get that poor review from when the different companies send out their yearly reviews. What was your experience in the emergency room? What was the wait time looking like? Nobody no want to hear say them are waiting in an emergency room for 30 minutes. They don't want to hear that. And so that is the problem we find. We tend to compare the situation here in America with the US, with Jamaica so much, but they don't really understand. So you can't use the system here in America and compare it because 3/4 what we're comparing things to, it don't make no sense. We cannot do that. You cannot compare it to the Jamaican system because the Jamaican system already twisted. There is nothing there to compare. You understand? There's nothing there to compare. What you can compare it with is that when you talk about quality nurses that are being produced in Jamaica, that's where the work come in. You talk about comparison. And I'm not talking only because of talking sake. The quality nurses that we have here in Jamaica are good, well-trained nurses. They might do a bag of things in America, but the thing about it is that we don't see it when we're in Jamaica because we're so focused on the negatives. We're so focused on things that are not going well. We're so focused on things that are of least importance at that time. You understand? While nurses are trying to care for patients who are dying, we have time to be sitting down focusing on, oh, they put my mother on the floor and they take a picture and they put it up on YouTube and Instagram and Twitter and TikTok. But nobody is showing the bigger picture of what the work environment looks like for the nurse. Environment is just not good. At least that's when I was working there. I'm sure no said the situation doesn't change. The situation is the same today. You understand? The situation is the same today. Because there is not much improvement. You don't have much nurses being hired in Jamaica right now. You don't have that much nurses in Jamaica right now because recruiting companies are still taking them away. And you can't really complain about the nurses who are leaving. Because if the situation, if the work environment is like that, them have them student loan, them have bills to pay. Nobody don't want to each up with them parents throughout college and then now work as a big nurse and still have to each up with them parents. Nobody don't want that. Everybody wants to be independent. And so when the opportunity comes, just like when everybody else get the opportunity to go away to work to go on the farm and work, or they get opportunity to get filed for because them have some family that was overseas who had already got the opportunity to go overseas and file for them, or some people who just, good luck, them have them parents who already did an American citizen or UK citizen or Canadian citizen, and a year time now for you go overseas and work. It's no different from the nurses. It's no different for the teachers. You understand? But we not focus on the teachers, them, we focus on the nurses, them. So I just don't like the fact that we're diving so much on the nurses and we don't really understand where they're coming from in all of this. You understand? We don't understand what their situation is, why they're doing what they're doing. We don't understand what the work environment is like. But I enjoy working in Jamaica as a nurse, and I learned a lot. I learned a lot of things in Jamaica as a nurse. You understand? So when you talk about top nurse, you talk about the Jamaican nurses. Because them have the knowledge, them feel as though, you can't talk to them certain way and whatever. And me understand what that, me understand it. You understand? But outside of that, the nurses, they did wonderful job for their patients given the circumstances, but it's just that we major in the minor. We major in the minor so much that we forget about what we're really doing. But at the same time, me not really compare and bash nobody, but I'm just saying we need to understand the work environment for these nurses. We need to understand the work environment for these nurses and what they experience on a daily basis, what they're going through. Some of them not taking a break. They can't take a break because only 2 of them on the floor and you have a patient over there, so we are code. And yes, they might have a doctor or you might have an intern and that's it. But they can't take no break. So when them laugh loud a little bit, they might probably laugh off some of the stress. You understand? When you see them eat at the desk, it's because they can't really do any better. You understand? But at the same time, I'm sure they're trying to be professional in every aspect of what they're doing. So I don't know. If you have anything to add, you can go ahead and add it. My true experience working as a nurse in Jamaica, it did hard, it tough. And when I come over here, yes, it feel like a better rose over here, so. But at the same time, I appreciate the knowledge, I appreciate the experience I got from Jamaica, because it built me, it made me into the person that I am working in the US. Because when you talk about critical thinking, when nurses go think about what am I going to do next and what am I going to do after, yes, it's because of the environment that we were working in that has put us in that frame of mind. You understand? As soon as I hear an ambulance, a siren go off, you start get jittery, your adrenaline turn up, because you know say it can be a patient that is coming to you. And it wasn't a case where a patient coming directly to you, it was more teamwork. You understand? It was teamwork. So you don't have one nurse I focus on one patient and not try to resuscitate the one patient. No, it's a team effort. You understand? It's a team effort, and that is one thing that I love about working in Jamaica. You have teamwork. Up here, yes, you have teamwork, and that's what they say. It's teamwork, but when you come on, it's not a matter of teamwork, it's whether or not them like you. It's not a matter of teamwork, it's whether or not they do like you. Whether or not, you know, you are talking the way they talk, walking the way they walk. You understand? That's what the situation is all about. So I don't know, but big up to the nurses in Jamaica and big up to the emergency room nurses. I know that when I was there, things were good. You know, but it could have been better. And opportunity come, opportunity go. You take it, you leave it, whichever one you walk with, God go with you. Until then, thank you so much. Please remember to like, share, and subscribe to the channel for more, and turn that notification bell on. All right, bye.